Gross description for pathology specimen is an important aspect for pathology. It is part of a pathology report. When the pathologist releases a pathology report, the way to communicate with the surgeon or clinician is by the report. There are a lot of components for gross description, but for medical students, I will just highlight the one that is important. I'm Dr. Patologi Joe from School of Medical Science, University of Science Malaysia. Let's begin. Before we start, I will highlight two tips. Number one, describe the obvious pathology. You should describe in detail the most prominent pathology. If there is a second pathology, you could describe it after you have done describing the main pathology. Be systematic. Number two, use proper medical term. For example, anterior, posterior, medial, dorsal, and avoid using layman term like at the side, above, or below. To warm up, let us start with an example. What can you see in this picture? We can describe it as there's a needle pin stuck at the tip of the pencil. We can then detail our description by saying or writing, the pin is stuck at the wooden part of the tip of the pencil. The pin has round, black head. By this description, the reader of the report can imagine how the pin stuck to the pencil. He or she also knows that the pin has black head. Now, let us apply describing art in a real specimen. The picture shows an open colon. What can we say about the colon? We can say there are two lesions seen at the colon mucosa. We can further detail our description by saying or writing, the lesions are ulcerated, the ulcers have irregular margin, the edges are rolled up, the floor of the ulcers is made up of whitish material. This photo shows ulcerated lesions. What you need to describe is about the ulcer. You need to include the description about the margin of the ulcer, the edge of the ulcer, and the floor of the ulcer. Sometimes from the gross description we can determine either the ulcer is benign or malignant. You can see that from the example I use, I have described the main pathology of the specimen and use proper medical term, which is the edge, the margin, and also the floor of the ulcers. Describing pathology specimen is part of a job for anatomic pathologists. You might be wondering on why does a medical student need to learn the art of gross pathology description. The reason behind it is some of you might end up being a pathologist, whereas others might encounter the need to read pathology report. So by understanding the art of describing, you could understand the pathology report in the future. Till my next video, you can subscribe and follow me through these social medias. Thank you and goodbye.